been a real pleasure interviewing a lot of different folks who have been awardees from the Shils Entrepreneurial Fund, but I have to say this one is a special interview where I have Dr. Mike Alfano with us. Mike has been a mentor and a friend to me for many, many years, and I consider him one of the people that actually helped shape my career from the early stages to today, and continue. I think a lot of the success that all of us have in our careers are through mentors like Mike. So this is really an honor, Mike, to have you with us. Dr. Alfano received 2 awards from the Shils Entrepreneurial Fund. He won an award. He was awarded a 2004 recognition for the Oral Cancer Consortium that he established. And then in 2020, he received the Shils-Meskin Award. And just to read that to you, Dr. Michael Alfano, Professor, Dean, and Executive Vice President Emeritus of NYU, in recognition for your exceptional leadership and expertise as a researcher, educator, author, business executive, academic leader, and international thought leader for over 4 decades. Having known and worked with Dr. Edward Shils and fellow Santa Fe Group co-founder Dr. Larry Meskin, you are uniquely qualified for this recognition. And so with that, Mike, thanks for joining us as part of this celebration of the 20 years. I want to ask if you had any opening comments before I go to the questions.
No, I just want to thank you for the kind invitation, and also each of my experiences with the Shils Foundation has been quite fulfilling. So I'm happy to chip in and try to help once again. Thank you,
Mike. So you've left NYU formally. You're not there anymore. I know you've been very busy with Santa Fe Group, which we're both part of, as well as other activities. Can you talk a little bit about what keeps you busy currently?
Sure. I retired from NYU in 2014, but I've been busy ever since, primarily, as you indicated, working on projects and programs designed with colleagues at the Santa Fe Group. And some of those have become quite interesting. For example, 6 years ago now, we started an effort to add a dental benefit in Medicare. A very difficult challenge, to be sure, given the politics and the amount of money potentially involved. But as most of the viewers of this piece will know, we came very close late last year with the Build Back Better Act, which had at one time a component in it which would have added $24 billion with the B, $24 billion dollars per year into oral care for people on Social Security, or in Medicare, I guess I should say, to be more precise. We haven't given up. We continue to work with a consortium of some 234 organizations. And our approach now is to try to have Congress focus on the benefits to society of a dental benefit in Medicare for those who have systemic diseases. We believe this can be delivered at a net cost savings, but just to be safe, we'll say at no cost to the public. So stay tuned, and we'll see how that works out.
Great. Yep, I know personally you've been, from my relationship with you in Santa Fe, you've been extremely busy, probably busier than you were when you were dean of a dental school, maybe close.
Certainly not dean of a dental school in the COVID era.
No,
I was lucky to have missed that.
Yeah, someone who had a year of that, I would not wish it on anyone. So that's right. It's true. So you received 2 awards from Shils. Can you talk a little bit about what those awards have meant to you?
Sure.
Over the course of the two awards that you got?
The first award was for helping to found the Oral Cancer Consortium. This was a coalition of 35 institutions in the Northeast that came together periodically to focus on oral cancer in a way that would educate the public. And so we would take out ads in major newspapers talking about oral cancer. We frequently were on TV, often with the local weatherman, doing a remote site shoot and offering free oral cancer screenings. There were other activities that also contributed. So Larry Meskin, for example, you mentioned him earlier, co-founder of the Santa Fe group, happened to be editor of Journal of the American Dental Association at the time. And he wrote some powerful editorials to try to bring the dental profession around. Hal Slavkin, another Santa Fe group founder, started 5 research institutes focused on oral cancer. So all of these things combined to make a rather dramatic shift in the number of people who actually got an oral cancer exam when they visited the dentist. When we started the effort, 7% of patients reported that they had such an exam when they visited a dentist. And the way you do this is you describe the exam, and they'll either say, yes, I've had that, or no, I haven't. And yet, if you were to ask dentists, in the low 90s percentages of them said they did do oral cancer exams. So if they were doing the exams, they were doing a different exam than is typically taught in dental schools. 8 years into the program, it went from 7% of people having had that experience to almost 30%. So if you look at it one way, we help to quadruple the number of people who get this important evaluation. And if you look at it another way, 30% is still not a very good number. So I wouldn't be surprised if Santa Fe and others took another crack at increasing public awareness. So Shils at that time helped focus attention on this important area. The more recent honor from Shils, I think helped us to focus on the Medicare dental benefit and another initiative we've been working on, which is related to the Medicare dental benefit, namely that oral health is integrally linked to total health. The recent NIDCR report says as much. So that's very good to see at the federal level, the linkages are being described more and more tightly. I think we will soon be seeing definitive proof that this relationship is causal. So right now, based on insurance industry data, I believe it is causal, and I believe insurance companies are acting on the data and saving lots of money in the process on the systemic health side.
Thank you, Mike. So just switching gears a little bit, and I know one of the things we struggle with at Santa Fe, because we're a small group, we're very active, but we're a small group, but there are a lot of issues out there facing us in the oral healthcare space. Even if we put aside trying to make a stronger connection to the broader healthcare industry, which we're trying to do as well. What are some of the changes that you see we need to kind of tackle? What are some of the things we need to tackle over the next few years in order to ensure better oral health in the future?
Yeah, that's an excellent question, because the bottom line is that's what we come together to do. You know, organizations like Shils, like Santa Fe, and so many other professional organizations. So let's look at it from the big picture perspective. And we could talk about better approaches to pedagogy and dental education and the like. But to me, the area where the profession is perhaps failing the public most significantly is in communicating what good oral health can be and should be, and how it's related to their general health. This is probably a sore point, and it may not make it into the final cut of this interview. But the fact that we as a society missed out on adding a dental benefit to Medicare just in the past few months, driven primarily by professional dental organizations who do not want change, who seem not to really want a fulsome dental benefit in Medicare. And to me, it left society short. We should have been more forthcoming. And it wouldn't have been hard to do that, because as I think I mentioned earlier, at the time, there was $24 billion in new funds that were going to be applied to the oral health sector. And anyone who knows our enterprise knows that's a substantial increase in busyness for the dental profession. I mean, that's looking at it at the crass level, the monetary level. The focus we had was reaching 60 million people, the majority of whom have a difficult time acquiring dental care in their aging years. So missed opportunity. I believe we disappointed society by not being forthcoming. I mean, if it had turned out that there was support across the board and the country decided it just didn't have enough money to do that, that's a different story. But the fact of the matter is, many in our profession fought the benefit vociferously, and I believe many practicing dentists didn't really understand what was going on. I believe they were fooled, and that's a shame. Yeah. So changes I'd like to see more active engagement by practicing dentists to really understand what that benefit might have looked like, what it might have done for society, and what it might have done for their practices. Doesn't appear we're going to know that in the near term now.
So we're coming up onto May of the year, and May is always graduation time at academic institutions, including dental schools, and you've been through many commencements in your career. What advice would you give to a new graduate finishing dental school right now?
So, I mean, the standard advice is stay up with your education, continue to learn, continue to improve, continue to take continuing education courses, continue to practice ethically, because sometimes new graduates can get involved in scenarios where there is effort to diminish the ethical approach to clinical practice. So of course, watch your P's and Q's as far as how you manage the patients in your practice. And staying on the theme from a few minutes ago, be sure to stay apprised of what's happening in healthcare per se. Pay attention to the fact that general health insurance companies are thinking about entering the dental insurance business because they understand better than practicing dentists that if people get dental care, preventive dental care, pretty much anything that prevents inflammation in the mouth is going to reduce the total healthcare burden on society. So those changes are coming. They will be the kind of sea changes that can't really be fought at the State Dental Association level. They're going to be overwhelming when they come. And I'd advise young practitioners to embrace it because it's going to be good for your practice.
So the final question is hopefully ending on a positive note, and would love to hear from you your thoughts and what you're optimistic about relative to the dental and oral healthcare space, dental industry. What excites you that's happening now and going forward into the future?
So I'm going to stay pretty much on with the same theme. I love to be optimistic. I am an optimistic person. As I look at the dental profession, my optimism is actually driven more by what people outside of the dental profession are thinking and planning in relationship to the delivery of oral care, as opposed to those in the profession itself. It pains me to say that, but I am optimistic that insurance companies will move forward. I am optimistic that the federal government will come to understand the power of dental care in reducing healthcare costs by promoting more health, by reducing hospitalizations is the primary way that money is saved. So I'm enthusiastic about that. I also believe, the corporate sector, the people who produce the various new technologies that come to bear on the dental profession will continue to innovate, and that improvements will continue to be forthcoming and continue to be genuine in their ability to change the way people function and make them healthier and even prettier. something we also do rather well in our profession. So a little bit mixed, but I think in the long term, there's reason to be optimistic. I think there's also reason for optimism because the profession continues to attract a very talented pool of young people who want to come and share their talents in this profession. And we wouldn't be anything without a continuing pool to challenge old fogies like me to be better.
It's true. It's true.
Oh,
Well, Mike,
it's true. I'm an old fogey.
yeah, I was going to qualify that, but you know, we'll leave that for another interview as far as the old fogies. But listen, it's been wonderful having you be part of this celebration for the Shils Entrepreneurial Fund. Again, congratulations on both of your awards. And again, personally, thank you for all that you're doing for the profession and moving us forward. I know at times it can be frustrating and challenging, but you're a Jersey guy and you're very persistent, speaking as one as well. And you know, we don't take no for an answer often, and we'll find a way. So thank you again, and hopefully we'll see you in Philadelphia for the celebration.
I appreciate your time to this project because I think it'll help some young people.
I hope so too. I hope so too. Thank you, Mike. It's been a pleasure.
Take care.